Hey everyone, it's Dr. Russell, and today I want to talk about something that affects a lot of women as well as men in the patients that I see, but it's something that is very commonly overlooked or just missed completely. And that is some surprising symptoms of anemia or deficiencies that tend to be associated with anemia. So you'll hear very shortly a lot of these things can be mistaken for other issues, and when they're not thoroughly investigated, that's where sometimes it can be very frustrating because you know something's going on and it's not in your head, as I had talked about a few weeks ago. But this is an example of one of those times where maybe there is something deeper going on that needs to be investigated. So when it comes to anemia, all anemia is just a lesser amount of red blood cells. There are different kinds of anemias. I think that is one very common misconception. When we hear the term anemia, we think iron deficiency, but there's other nutrients that actually can affect red blood cell population, as well as the size of the red blood cells, the basically color, the volume, things like that. So definitely iron deficiency is one of those, but the other ones have to do with some B vitamins like B12 and folate. So those also can affect the production of the red blood cells, and it's another important nutrients to evaluate for, which we'll talk about at the end. So as far as symptoms go, when it comes to anemia, I think we all know we associate with feeling fatigued, more run down, tired, maybe some weakness, pale, so like pale gums and pale face. So those are very common ones we associate with. But some other less well-known symptoms can be shortness of breath, especially I find where people say, I'm pretty fit, but sometimes when I just walk up the stairs, I feel like I can't catch my breath. And that kind of makes me start wondering if there is some kind of anemia or issue like that going on. Other issues that can occur with anemia, you can have heart palpitations, and then pair that with shortness of breath. And what does that sound like? That sounds like anxiety. So a lot of people have physical symptoms of anxiety. Maybe they don't have mental symptoms of anxiety. That is another clue that would kind of make me start going down that path of ruling that out. Some other things from anemia, particularly with iron. We know iron deficiency is associated with restless legs. So if people find that they have trouble sleeping at night, sometimes it's an iron issue, as well as brittle nails when it comes to iron deficiency. And we also know iron is very important for thyroid hormone production. So if someone has an underlying thyroid issue, always want to check for iron, just to see if there's any kind of issues with that. Some other symptoms, not so much with iron, but with the other B vitamins like B12 and folate, can be memory loss. So maybe, just having trouble recalling things, or your memory's not quite what it used to be. Even tingling feet. So what we kind of usually associate it with more maybe diabetes, but maybe it could actually be a B12 or folate issue. Swollen tongue or issues with taste and smell, which obviously right now it's a concern with COVID, but that could also be due to a B12 or folate deficiency. Mood changes, so like depression or anxiety definitely could be associated with that. And then even difficulty walking when it comes to B12, things that would lead you down a more kind of serious workup as far as, as there are some other serious neurological issues going on, but it could just be something as a B12 deficiency. When it comes to folate, there is a lot of symptoms, and I'll talk about in a second when we evaluate for B12, we also can easily evaluate for folate deficiency. So I usually check it in most people if I can. The other thing I want to point out is that you can have these deficiencies like iron or B12 or folate and not be to the point of having true anemia yet. Anemia is something we easily screen with what's called a complete blood count. So it's a CBC for short, and it looks at your red blood cells, your white blood cells as well, but then it shows us that basically color and size of the red blood cells to kind of give us clues if they're too large, too small, too pale, too concentrated, what's going on with them, and can that tell us about the nutrient deficiency? So I usually will order a CBC. It's something your doctor probably regularly orders for you. But again, we can have these deficiencies start before we get the true anemia showing. So the other test that I like to run for people that you can definitely ask your doctor to do is to do just a general iron panel. But I also like to look at ferritin, and ferritin to me almost trumps the iron panel just because ferritin is telling us your iron storage versus the iron panel is kind of like what is in that moment. When it comes to B12 and folate, this is a big pet peeve of mine. Checking serum B12 and serum folate is really not that accurate. So I really don't take a lot of clout when I see those tests that have been done, and that's why someone's put on B12 or folate. Again, it's showing you kind of in that moment. What's really more accurate is to check homocysteine and methylmalonic acid, and those two markers will give us a much better indication of if there's a B12 or folate deficiency. And the way they work, just to keep it simple, is if the number is elevated, it actually shows a deficiency. So I think of it kind of like a dam where the river's getting blocked or the water's not flowing. So it's showing that deficiency because it's not allowing the water or the chemical in this terms to flow through and be more even. So those are ones that can be ordered. I know some insurances don't like to cover them, a lot do. So again, it's something that I would just talk about with your doctor potentially. But homocysteine is looking at B12 and folate. Methylmalonic acid is just looking at B12. So if we know, for example, methylmalonic acid is fine, but homocysteine is off, then we know that could be more of a folate issue. If they're both off, then it could be both folate and B12, or it could just be a B12 issue. And this, again, is definitely something I see with women, especially in perimenopause. You know, we can have where periods start bleeding more heavily, which is always fun. Or if you're just not eating the best nutrients and, you know, maybe not absorbing as much, or if there's any digestive issues affecting absorption. I mean, there's many factors, but definitely these are some simple tests that can be run that, you know, we can easily rule these things out. So to sum it up, you know, some really strange, unusual symptoms that we can get from an iron deficiency, B12 or folate. So we can have neurological issues, we can have things that present like anxiety, but maybe are not actually anxiety, and then, you know, all kinds of other stuff, mood changes, all those things. So hopefully that was helpful. Let me know if you have any questions, or if, again, this is something you might want to have your doctor start looking at, just if there's, you know, you're worried about something else deeper going on. So I will see you all in 2 weeks, and I hope everyone enjoys the nice sun we have today. Bye.